Hello, my name is Maria,
And I'm Kelly.
and we are students of the Lake Washington Institute of Technology's Dental Hygiene program. We have conducted a research project on the topic of marijuana and periodontal disease. In order to conduct our research, we needed to first understand what periodontal disease and marijuana are. Periodontal disease, also known as periodontitis or gum disease, is a chronic inflammatory disease caused by a bacterial infection of the tissues that support the teeth, such as gingiva, which are gums, periodontal ligaments, fibers that hold the tooth to the tooth socket, and alveolar bone, bones surrounding and supporting the tooth. If severe enough, the periodontal tissues that surround the teeth may recede and bone loss occurs as a result. Marijuana, also known as cannabis, is a psychoactive drug that is commonly smoked for both medical and recreational purposes. For simplicity's sake, we will be referring to the drug as marijuana. The purpose of our study is to find if there is any correlation between smoking marijuana and periodontal disease. The prevalence of periodontal disease is high within the United States and worldwide, and with the increase in medical marijuana legalization and recreational marijuana legalization across the United States, we began to wonder what impact marijuana has, if any, on a person's oral health. The possible harm that smoking marijuana can cause to the oral cavity should also be considered, along with the fact that smoking either tobacco or marijuana are both modifiable risk factors that lead to oral conditions currently associated with periodontitis. We'll be using our PICO question to guide our discussion. For adult patients, will smoking marijuana result in higher rates of periodontal disease compared to adult patients who do not smoke marijuana? To answer this question, we will be examining several sources to analyze the rates of periodontal disease amongst adult marijuana smokers compared to the rates of periodontal disease amongst adults who do not smoke marijuana. In an attempt to locate statistically reliable and clinically relevant studies, we conducted research by using PubMed, EBSCOhost, Google Scholar, ScienceDirect, MDPI, and ProQuest as our databases, using mesh terms such as periodontitis, periodontal disease, marijuana, cannabis, and periodontal prevalence. We use Boolean operators such as and or. Although our topic is one that does not yield a great amount of results, we were still able to filter our search to ensure that they consisted of only peer-reviewed articles. To understand the possible link between smoking marijuana and periodontal disease, it is important to understand risk factors that lead to a higher likelihood of periodontal disease. Dry mouth prevalence, also known as xerostomia, which itself is a risk factor of periodontitis, increases after smoking cannabis. Cannabis may also cause alveolar bone loss by interfering with osteoblasts and osteoclast activity.
Several studies conducted show a direct comparison of the rates of periodontitis between adults who do and do not smoke marijuana. A regression study by Sharif et al. Showed that after controlling for demographics, alcohol and tobacco use, diabetes mellitus, and past periodontal treatment, frequent recreational use of marijuana was linked with higher levels of clinical attachment loss of the periodontium to the tooth. In another study, periodontal inflammatory status was worse in marijuana smokers compared to non-smokers without periodontitis. Lee and Palomar conducted a study that recorded marijuana smokers' overall poorer oral health status, as well as the positive relationship between cannabis use and increase of clinical attachment loss and xerostomia. Another study conducted in New Zealand over the course of 14 years also reported that groups of adults who had the highest use of marijuana also had the highest rates of serious periodontal disease, and 1/4 of the adults who smoked marijuana had significant gum disease. We also found in one study conducted by Liu et al. That the effects of tetrahydrocannabinol, or THC, the active component in marijuana, may actually increase periodontal fibroblast cell adhesion and aid in periodontal regeneration. But it is important to note that this study was done in vitro and did not include the normal combustion factors that are associated with the action of smoking marijuana. While research in this area is still sparse, the possible therapeutic effects of marijuana on the oral cavity should also be considered in future studies. It is important to note that for all of the studies involving human participants, there is the strong possibility for volunteer bias, as all participants, by design, had to volunteer to be included in the study. This could skew results, and studies may not be representative of the entire adult population. Many of the studies did not do full mouth periodontal charting, choosing instead to only probe 3 sites per tooth instead of the usual 6. This method of measuring periodontal health is likely not the best measurement of overall oral and periodontal health in an individual. Many marijuana smokers also smoke tobacco, which is a known modifiable risk factor for periodontitis. In many of the studies we researched, efforts were made to isolate the effects of tobacco smoking from marijuana smoking, but the correlation between smoking tobacco and periodontitis may still have interfered with the results. In conclusion, we found that smoking marijuana does result in higher rates of periodontal disease compared to adult patients who do not smoke marijuana, but we must keep in mind the limiting factors just described.
Some questions we would like to pose to the audience are, do any of our results or interpretations contradict what you know to be fact about the relationship between periodontal disease and smoking marijuana? Secondly, what information do you wish we had discussed further or included? Lastly, if you are an oral health care provider, knowing that there is a strong positive correlation between smoking marijuana and periodontal disease, how would you educate patients on this etiologic factor?
Thank you for watching our presentation.